This topic is applying external urinary devices. So let's talk about some of the reasons or indications that a client may need an external urinary device. One of the first indications would be if the client is experiencing urinary incontinence. So let's break down the word incontinence. Continence is when the client has full control over their bladder and bowels. So incontinence means the client has lost full control. So urinary incontinence is when a client has involuntary leaking of the urine. Reasons urinary incontinence can be present can be due to medications, surgery, childbirth, even some diseases such as Parkinson's disease. Strokes can also cause a loss of control of the bowels or bladder. Another indication for an external urinary device is to increase the client's comfort level as well as decrease their risk of infection. As we know, an indwelling urethral catheter can cause urethral trauma as well as increase the risk or susceptibility of infection for the client. Therefore, an external urinary device can help decrease these risks. External urinary devices can also help promote autonomy for the client and promote voluntary urination if the client is still able. Urine samples may also be collected through these external urinary devices for a UA or urinalysis to be obtained. External urinary devices may also assist the nurse in monitoring urinary output as well as strict urinary output if needed. It's important to note that external urinary devices may be used for our female and our male clients. External urinary devices for the female clients use continuous low-pressure wall suction. For our male clients, the nurse may apply a condom catheter or a hydrocolloid device. Let's discuss in detail in a step-by-step process as to how the nurse would apply a female external urinary device. Before performing any type of procedure or skill, the nurse needs to implement basic safety guidelines. These guidelines include properly identifying the client, checking for allergies, explaining the purpose and what the client can expect during the performance of this procedure or skill. So for our first step, we are going to implement one of our basic safety guidelines, and that includes proper hand hygiene and applying new clean gloves. This is an aseptic technique rather than a sterile technique. The nurse may then apply the external urinary device. As you can see in the image to the right, the nurse first needs to separate the labia with the non-dominant hand and then apply the external urinary device to the perineum with the opening of the device at the opening of the urethral orifice. This way, once the urinary device is applied correctly, it may then start collecting urine into a collection container. Remember, this is done by applying the continuous low-pressure wall suction. The nurse will then secure the catheter tubing to the suprapubic area. It's important for the nurse to remember that moisture affects skin integrity. So the larger or higher amount of moisture present, the increased risk of skin breakdown. So these female external urinary devices need to be changed every 8 to 12 hours or when soiled. Monitoring for skin integrity is extremely important. The nurse needs to follow their hospital or facility guidelines in regards to how frequently to check for skin integrity. Now let's discuss how to apply a male condom catheter. As always, the first step will be to implement proper hand hygiene and to apply new clean gloves. This is also an aseptic technique rather than a sterile technique. The nurse will then ensure that the skin is clean, dry, and intact. For our clients who are not circumcised, the nurse will ensure that the foreskin is not retracted. Again, this only applies to non-circumcised clients. The nurse will then provide perineal care while also monitoring for any moisture. If moisture is present, it needs to be wiped away or dried. The nurse will then apply the condom catheter, first by placing the non-dominant hand on the penis to hold it securely, and then unroll the sheath onto the penis. Again, making sure for our non-circumcised clients that the foreskin is not retracted during this process. Once the condom catheter is secured, the nurse will then attach the catheter to the drainage bag. It's important that the nurse allows there to be slack in the tubing from the catheter to the drainage bag. The nurse will then secure the drainage bag to the leg, as you can see in the image to the right. Now let's discuss how to apply a male hydrocolloid device. It's important to note with any male external urinary device, the nurse needs to ensure that they're choosing the proper size of the device per manufacturer's guidelines. As always, the first step the nurse will take is to implement proper hand hygiene and apply new clean gloves. This is again an aseptic technique rather than a sterile technique. If pubic hair is present, the nurse will then clip the pubic hair rather than shaving it. Shaving can cause small microabrasions, which increases risk of irritation and infection. If the client declines for pubic hair to be clipped, the nurse may apply a hair guard instead. The nurse will then remove the paper film from the faceplate. And as you can see in the image to the right, the nurse will then place the faceplate over the midline of the meatus. The nurse will then smooth the adhesive strips over the penis, again, as you can see in the image to the right. The nurse does need to ensure that the adhesive strips do not have any wrinkles or folds, as these can trap moisture as well as pathogens, which increase risk of skin breakdown and infection. The nurse will then cover the device with a seal. The last step the nurse will take is to connect the catheter to the drainage bag, allowing there to be slack in the tubing. The nurse will then secure the drainage bag to the leg. Now let's discuss how to apply a pediatric external urinary device. This device may be applied to a female or a male pediatric client. As always, the first step for the nurse will be to implement proper hand hygiene and apply new clean gloves. Again, this is an aseptic technique rather than a sterile technique. It's always important for the nurse to check for any moisture present before applying any external urinary devices. If moisture is present, the nurse needs to ensure that is wiped away or dried so the skin is clean, dry, and intact. The second step will be for the nurse to remove the paper backing from the faceplate of the device. The third step will be for the nurse to apply the adhesive urinary collection bag around the genital area and wait for the patient to void. This step is depicted in the image to the right. It's important for the nurse to center this urine collection bag around the genital area so that no inner folds of the groin are included. This ensures a proper seal of the adhesive. These pediatric external urinary devices can assist the nurse in obtaining a non-sterile urinary sample, as well as monitoring urinary output. Now let's discuss important and appropriate nursing interventions to implement when applying an external urinary device. One of the number one priorities is to ensure that the client has privacy throughout this procedure. The nurse can do this in many ways, by closing the door, closing the privacy curtain, and ensuring that any other body part that's not involved in the procedure is covered. The nurse also needs to check or verify if the client has any latex or rubber allergies. Changing and cleaning these external urinary devices is extremely important, and the nurse needs to do this according to manufacturer or hospital guidelines or protocol. Checking skin integrity frequently is extremely important. Remember, the higher amount of moisture present, the higher likelihood that there will be skin breakdown. So checking this frequently can help prevent any type of wounds or breakdown in the skin. Record urine output and monitor for tube patency. It's important for the nurse to check for any kinks in the tubing, any leaks in the tubing, as well as any obstruction inside of the tubing. And don't forget to document the procedure, because if you didn't document it, you didn't do it.